Good evening, I'm Alex Loroff. In medical emergencies, EMTs and ambulances can make the difference between life and death. Because of that, state lawmakers are proposing legislation to improve these services. And First News at 9's Daniel Gomez explains communities from a particular setting need the most help.
Alex, Republican State Representative Karen Hurd says rural communities are suffering from EMS workforce shortages. In order to help remedy this, the legislation she and two other state legislators introduced look to tap into younger recruits. A trio of Republican Wisconsin state legislators are working to bolster the emergency services workforce.
What we're proposing is that 17-year-olds be allowed to be a part of the emergency medical services.
Representative Karen Hurd says having adequate staffing is necessary to help with ambulance response times, even more so in rural communities.
It's not that they're doing an inefficient job no, it has nothing to do with that. If you don't have the people, you don't have the people.
For teens interested in jumping into EMS work,
we've built in safeguards because, we wanted 17-year-olds are still considered children. They're minors.
That includes parental permission, having a sponsor in the field, following child labor laws, and keeping up with their school attendance. And Hurd says there are apprenticeships offered to high schoolers.
They can be taking the training, and then the state would actually reimburse the schools for them taking their EMS test, and then they can work in the field, and we need them.
Bloomer Community Ambulance Service Chief Mark Schwartz says when he started over a decade ago, it was fine having shorter teams.
But back then, we were only doing 300 calls a year. Now we're doing 800 calls a year. Every year, our call volume is our new record high. And it's been like that for the last couple of years now.
And with more and more calls coming in, he says bringing in new blood could be the answer.
I think any legislation that helps us increase access to the education that youth can take advantage of is great, because while our patient population is aging, our provider population is aging too. We've had people on our service here in Bloomer that have been on for over 34 years. They're not going to be here for another 34 years. So we need some youth to get in here and start filling in the gaps of where we have our aging population start leaving.
The other two legislators in that trio are Senator Jesse James and Representative Warren Petrick, who are also joining Hurd on that bill. Hurd did say that it could take after Christmas when the bill could make it on the floor, and if all goes well, that law could go into effect in 2024.